All the listeners of Education Lecture Series. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. And you are listening me on Facebook, YouTube, Sabrang radio stations. As you know, we are delivering lectures on health education lecture series regarding the life. How the life was started, how developed, and what were the complications, diseases he faced time to time. And regarding those conditions, we are discussing with you what medical science has done so far for all these conditions. In our last lecture, we were discussing about the management of toddlers. I would just like to remind you that we have already covered the artificial immunity type, that is created immunity, and that is known as immunization by way of vaccination, by way of immunization. This is done, and most of the diseases which were very serious, and even the newborn kids at the toddler age, they were dying with those diseases. But with the achievements of the medical science, we are now capable of eradicating those diseases and also curing those diseases. In last lecture, we have completed vaccinations for hepatizations. We have discussed about the different categories of the hepatization, uh, mm, hepatitis B, hepatitis A, hepatitis C, D, and E. And there are differences. I have already discussed about that. There are little minor differences in between each of the virus, and but mainly they are concerned damages the liver and damaging the liver of the newborns, and there were many more other complications, symptoms and signs. We have discussed about that. After that, we discussed about the uh, diphtheria, tetanus, and pertussis, means whooping cough. So all these things now we are able to manage, to cure, or prophylaxically, that we can provide medications, we can provide the immunity beforehand, whether or not the child is suffering from these type of conditions. But before that, we are maintaining his health, maintaining his body, maintaining his immunity as to the level of that, if ever in case he suffered from the attack of these kind of viruses from outside, he should be protected, or he should be capable of saving all these things. So in this way, all the vaccination, just like the influenza, be influenza, and then poliomyelitis, and then this pneumonia. Most of the diseases we have already covered, which were affecting the childhood and were killing the children. And now the second phase we have started. That second phase is after coming out from mothers, means after the delivery of the children from 3 to 5 years of age. Mostly this age is considered as the toddler's age. In the previous age, before 3 years of age, he was all totally dependent upon mother. Even the turning in bed, eating, sleeping, taking a shower, wearing clothes, everything, everything from day to day, from you can say the 24 hours. He was under our vigilance and also under sport. We were sporting him, even turning in the bed. So ultimately, when any duty has been assigned to us, that totally you are responsible for that, then definitely you will be well aware of that one. You will be attentive for that. And the same way, mothers are considered to be attentive, very vigilant, where question of children's health and children maintenance is concerned. So mother was very, very vigilant for this one. In this way, we were depending on the mother at that times. But regarding the viral diseases and regarding the bacterial diseases, which the child was suffering from, mother was unable to do that thing. And in this way, we have passed that time, and we created a science, you can say, the science of immunizations. With that, we are able to combat all these diseases in most of the countries. But still, all the developed countries, they have a set pattern for the vaccinations, and with that they are protecting the community, the newborn children, in that way. But in underdeveloped countries, it is still a problem because they are having deficiency of the means to provide artificial immunity immunizations to all the born kids. Therefore, still there are deaths with all these problems. So that area has been covered, and we are praying that all the community and all the conditions in all the cities, okay, they should have all the means to protect their kids by the vaccination therapy or by the artificial immunity. About the immunity, I have already told you that one is an innate immunity, which is he acquired from the parents, and the other one is the artificial immunity, which we create by means of artificial immunizations, depending on the principles that the same isopathy, same type of viruses in a dead condition in a minimum small quantity are introduced inside the body, and body is stimulated to take action against such type of virulent toxicities if it comes inside the body. Means just to make them awake, just like a person is sleeping and you want to make him aware from any incidences may not occur during his sleep time. And even if it happens, he should be attentive to take care of that one and to survive from all those things. The same pattern is adapted in the innate, in the artificial immunity, that the vaccinations are given to the body to make this life stimulations, so that if ever this kind of a virus comes from the environment, it should be able to take care of this one. So it's a stimulation type of that things, and whenever you stimulate the body by artificial means, it creates an artificial center inside the body, which is a permanent, which is a permanent that whenever, anytime this kind of virus will come, it will cover. It will cover that one. But some of the diseases do not have that kind of reactions from the body, do not have protective reactions from the body, you can say, that they are covered for whole life. Every vaccination has its limited time, and the vaccinations which we assume that they are lifelong now, it means It does not mean that lifelong, for 100 years, for 200 years. No, it means for a limited period, because the life of the person is a limited. If life of the person is limited, it means till the life of the person, this immunity is sufficient to cover that body, or the body will remain vigilant and active to go against that influences of the disease, of the viruses, if it happens during that period. And but most of the viruses we protect by immunizations have a limited effect. That is why most of the vaccinations are repeatedly given to the children, and also recommended for the adults also, at a distance, at a more distant, uh, just like 5 years or 10 years, just like the tetanus vaccination is advised that you should take it after 10 years, so that you should be protected and lifelong. So after 10 years, you have to take that. The same way for the shingles, varicella, measles, all these things from the herpes zoster virus. So this zoster virus remains latent inside the body for a longer period. But in case of children, if a child is suffering from this type of disease, ultimately he is cured. The active phase is over now, but ultimately, any time in his life, when he becomes adult or old age, this virus may become again reactivated if it has similar type of exposure. Means, because it's a contagious disease, and it is spreading by droplet infections or going near to the infected persons. And if the immunity of the elderly person is weak and he comes in contact with the infected persons, ultimately he may suffer from. But the name is different. At this condition, it is now known as varicella. Measles, no, it's known as shingles. But from the symptomatology, the eruptions it produces, they are same pulse type of eruptions, and but their pattern has changed. Just like in measles or in khasra, just like varicella, we have seen that they are on the scalp, on the face, on the chest, on the back, abdomen, all that, or some of the eruptions on the arms, extremities as well. But when it happens, or when it is reactivated in the elderly persons, at that time it has a different pattern of the eruptions in a row, in a route of nervous system, as the nerve goes, because this varicella zoster virus mostly affect the nervous system, and whatever nerve is affected, its tributaries, its distributions, all over it has eruptions according to their route. So in this way, this is known as uh, shingles when it happens in the elderly persons. So my purpose to convey this message to you is that most of the diseases may occur, reappear in the system of a person even after once it has been cured in the childhood. And that is why sometimes repeatedly vaccinations needed to again protect the persons from the similar type of viruses. It may not affect these kind of a persons. Even elderly persons, if they are not having and these kind of symptoms, but immunity is weak, and if the immunity is weak and they come in contact with the infected persons in these conditions, in this condition he may suffer from, but the name will be different. In this way, we have passed that phase. After that, the phase of toddler has started. Toddler means now the child is trying to do the things himself. He is trying to learn day to day living processes, day to day utilizations of this life, and he is very vigilant to copy. And suppose if you are not vigilant and he is copying you, ultimately you may work with fire in the kitchens, you may work with the knives in the kitchens, and if you are not vigilant, your child may suffer from injury. That is why it is recommended for the toddlers when they are school age, school going age, because previously the kids were going school at 5 or 6 years of age, but nowadays people are sending the kids at 2.5, even 3 years of age. That is why the toddler age is considered from 3 to 5 years. And in these conditions, the toddlers are very active. Toddlers are copying very fast. Toddlers are trying to do things by himself, so that so that you should be vigilant, because all the procedures, all the functions of the working what you are doing is not safe for the kids, or they are not competent to do that. And if they copy you and you are not vigilant, definitely they will hurt. They will hurt himself, injury. So in this way, how to manage toddlers? The first and foremost instructions is for the parents, for the mothers, especially whosoever is taking care of the child, that she should not avoid his vigilance, so that child should be free from his attention. So first thing which is advised for the mothers of toddlers, that they should still maintain the same character of maintenance which she was maintaining before 3 years of age of the child, because at that time he was not able to do things, and you are doing each and everything for him. Now the only difference is that you will watch her, you will watch him or her, let him do the things, but be careful. All the things which are injurious to him, try to save him and keep away from him, so that if ever, even under your vigilance, he is using a knife, he is using with the kitchen fire, no, do not allow him or do not bring him at that area, so that he can copy you, and ultimately and that may cause any injury to him. So the first thing which is advised to all the mothers or to all the persons attending the kids at the toddler's age is advised that they should be vigilant, that all the injurious things which which can hurt the children should be kept away from him. Second, understanding, because sometimes a child is hesitant, becomes hesitant forever, and sometimes children start stammering because of inferiority complex. Why? It is instructed that that you should not condemn the action of children's. Do not condemn the action of children's, whatever they are doing, because they are copying you. First and foremost thing is, they will not do anything new. They will do whatever you are doing, means they will copy first of all. And The copy they will do, even if the first thing we have already cut off those things which are directly injurious, you have cut off that one. But the other thing, he's copying you, and he will not be able to do the things according to you in a right directions. He may be wrong. And here, a special instruction has been given to the mothers in the children's maintenance, that you are not to condemn him. Oh, no, 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 you are wrong. No, forget these words for the toddlers. Do not say these words that you are wrong. Ultimately, because his language is not perfect, his functioning is not perfect, everywhere, everywhere he will feel insulted if you say, no, 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 you are wrong. Ultimately, a hesitation will develop, and that hesitation will develop in functioning. He will become lazy. A hesitation will develop in speaking, that he will start stammering because he is hesitant. You are condemning his actions. So, therefore, it is instructions to the mothers that whenever you are taking care of your toddler kids, then keep in mind whatever they are doing, they are copying you. Even if you are giving him toys, and the first of all, you are playing with the toys, then ultimately he does that. But he is not competent to do to play the toy in the right direction. Just like he's making blocks, and you tell him how to make the blocks, but he cannot do that. Here it is a special instruction for the mothers, that never say, "Oh no, you are wrong." No, and his language, he is not perfect in language. His vocabulary of word is not sufficient to explain all the things. Less just like I can give you one example. Previously, when our vocabulary was not sufficient, not having that much words, then to each thing we are saying eating, just like cane sugar, we are eating. Just like milk, we are eating. Even liquids and solids, everything was explained as eating. And now we have developed gradually vocabulary, and we know eating, chewing, swallowing, all these are different things. And sucking is different thing. Biting, different things. So in this way, he is not having that big vocabulary to use different words for the different actions of eating even. But in all the things, in all the play and all the routine things, he is not having sufficient vocabulary. Therefore, he will use the wrong words even. And at that time, you are not to condemn him. It is advised that mothers should listen him patiently and not to laugh. Mother should listen him patiently and not to laugh. If you laugh, he feel ashamed. He will develop, basically. He develop in inferiority complex in these conditions. Oh, everything I'm doing wrong, everything I'm speaking is wrong. And ultimately, though it's your mother, though it's your father, ultimately he will develop a hesitation. And functional hesitation may lead to, you can say, inability to work, sluggishness. The word you can use it is sluggishness, sluggish to work, slow to work. And in case of language, in case of speaking, he will becomes a patient of stammering because he is hesitating. Whatever word he's using, Ultimately, you say is no, wrong. Ultimately, a hesitation will develop in his mind. You do not know at that time, though you are correcting this thing. And many more children who are suffering from stammering or who are sluggish in functioning, all these things, it's not his fault. It is the fault of caretakers. And second thing, one more thing, beyond this limit, beyond the maintenance of the children's by the parents, beyond that limit is a limit of genes. Some of the things which comes from the mother and father. As I told you previously, that there are 23 pairs of chromosomes coming from the mother's ovum, 23 pairs of chromosomes are coming from the sperm of the male. Ultimately, they match and mix. I have already described this thing in embryology, how it happens, but I'm just for the uh, care of the your new kids or your toddlers, I'm telling you that most of the things, oh, you can say that, no, no, I'm not saying no to my kids, I'm not condemning to my kids, but even then there are some type of conditions developing in my children's. Who is at fault? Whose mistake is this one? That's why I'm explaining this thing, that though you are working with your toddlers according to these patterns, do you are not condemning, you are not obstructing him, and laziness or the stammering has not developed in that one. But sometimes other activities develop into the children's at this age because the previous age, even if he has some symptoms of any type of condition, I'm just telling you, any type of conditions, it goes in your love. You take it as a lovely child. Do not contempt on that. Do not even compare with that. But when the child is a toddler age and going to school age, when you compare it with the other children's, then you see some changes. Then you see some changes, that my child is different from others. Maybe more active, maybe less active, maybe he is not following the instructions, maybe he is not remembering the things which I'm telling you. Previously, you are saying, oh, it's a child, that's why he's not listening to me. I'm calling him, he's not listening to me. But ultimately, when he goes to school, and then you see that my child is different. Even the teacher recommends the parents that your child is different and he needs some different type of diagnosis of that one. And I'm telling you about the genetic characters, those type of conditions of autism and ADHD. These are two conditions in this age which comes in practice. And even if you have played your role very well, not condemned him, you have, you just were visible what he is doing, and for that instructions, just because he is having 23 pairs of chromosomes from mother and father, and ultimately they fuse with each other and again becomes 23 pairs. Out of these 23 pairs, one pair is a sex chromosome. 22 pairs are the genes which helps in maintaining the structure of the body, and the other one pair has the characteristic bindings, has the store of genetic characters from the parents to parents. And then in this condition, some children may develop autism, ADHD, which was not recognized in the previous age before 3 years of age because there was no comparative. Ultimately, sometimes there are siblings, elder brothers or sisters, siblings, and you see they are normal, but this child is different from them. Yes, Sometimes before going to school, you can recognize that my child is different, and you go to the doctors, and then he diagnosed maybe the autism, maybe the ADHD. But mostly, most of the children, especially those children who are the first child of the parents, they only recognize that my child is different when their child goes to school at the toddler age. And the teacher also says that he do not listen, that he jumps from one place to the other, that he do not remember, that he is sitting on one place and not rising up, not walking, and not listening to the commands. Then you worry about that and go to the doctors. Now, at this phase, doctors are not able to correct that one. Why? Most of the things you can manage when they are a child, they are known as autism or ADHD. When they grown up, they are known as absent-mindedness. Or sometimes this teacher says stubborn child. And ultimately, when he grows adult, that is known as absent-mindedness. So this thing prevails, not cured. Why it's not cured? Because it is coming from their genes. 23 pairs chromosomes. One chromosome pair has the sex character, has the genetic preservations of the characters which they have infused. Mother and father's chromosomes have fused now, has become genetic character, whatever they are explaining at that time. And now they are preserving the characteristics of mind, thinking, memory, irritability, anger, everything what was in their parents. Sometimes it happens that father was okay, he was not having any type of conditions, but his child has. And if you go back to the history, you will find that these were the conditions of his grandparents. Somehow it may. Sometimes these type of conditions remained silent, sometimes remained silent for one generation, two generation, three generations, and ultimately it comes up. Then when we forget that how was my grandparents, we forget that, and we say no, it is just immediately my child has different type of conditions, and it is called autism and ADHD. And why it happens, I can just explain you why it happens. Because one chromosome which has been fused and made from the mother and father has hundreds of genes, has hundreds of genes. 100 of genes means every gene has a different protein coding. Different protein coding means if you go and buy anything from the market, from the any stores, and they scan it, you see the scanning, this you can say a sketch of linings, you do not understand, but when they put their scan into the computer, it says the price is this one, its price is this one. Only the lining says it's a scanning. So I'm telling you that that pair of genes, which is made from the fusion of mother and father, was having hundreds of many genes from the chromosome, 23 pairs, one chromosome, which is fused, and then from one, there are many genes. That is why, that is why every child, even the twins, one twins may be normal, the other twins may have this kind of conditions. Depends upon the coding on their characteristic genes. And it preserves the behavior, attitude, thinking, intelligence, IQ. All these things are depending on those what gene is activated. What gene is more activated in this child? So if they are coming from the same source, then why one is activated, the other is not activated? Father was normal, mother was normal. Why this child has a different type of attitudes? Why different IQ? Even attitude, behavior, thinking, memory, all these things. Why this is different? Because suppose you have many type of seeds. You have many type of seeds and try to sow in a ground. All the seeds are not growing. Some of them remain latent in the soil. They do not grow. But some of the seeds become plants and grow bigger because the soil and the environment was suitable to those seeds who grow bigger, and seeds which do not grow was not having suitable soil and the environments. Many things, even in the universe, you see many things grows in a timely fashion. Many things grows when a suitable season comes, otherwise they remain dry throughout the years. And when there is a rainy season, many things grow up which you do not see previously. In this way, I'm coming to the point at this time. ADHD or autism, though it is in genes and it was in chromosomes, now from the chromosome it is in the genes, and genes had different coding. Most of the genes do not preserve that type of character, but some of the genes were preserving this type of character, which we consider the autism and the ADHD. And this ADHD and autism has developed because they found suitable environment in this child. So come to the point again, it depends upon the parvarish, means maintenance of the parents. Many things. Suppose a child is having uh, only mother is taking care of the child and father's died, or sometimes the mother is died, father is there, he is being taken care by the others. Definitely definitely this child will be different child from the others, with the quality of learning, with the quality of thinking, with the quality of behavior and everything. It has a different values. The same way, autism and the ADHD, which mostly are diagnosed at the age of toddler, develops, erupts into the personality at this age because of the suitable things. What are the suitable things? The suitable thing is that he want to do the things according to his manner, and you do not allow him. Therefore, in the philosophy of child care, it is mentioned that at this age, let the child do whatever he want to do. Then the second thing, you do the same thing. When he done, you do the same thing and do the same thing in the same pattern as he did wrong. As he did wrong, you do the things wrong. Do not correct first time. No. Then, after doing this thing wrongly, then you say, "Oh, I'm sorry, I'm wrong. I'm sorry, I'm wrong." Now, his wrong action was washed out. He's not having any inferiority complex. His action has been washed out in his brain, and now you are at fault. In his mind, you are at fault, and then said, "Oh, I'm wrong. Let me do it again. Let me do it." And now you do it in a correct way. And when you do this in a correct way, it means it will go into his mind that first of all he was wrong. He forget what he did. He was wrong, and now the mom has done the right way. Same way, do not interrupt him when he is talking. As I previously said, he is not having sufficient vocabulary to explain everything in the words. Therefore, do not object him and try to say the things according to he said, according to he spoke, and then wash it out. And then said, oh, no, 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 I'm wrong, I'm wrong. No, this way. This is known as drinking. You are drinking milk. You are not eating milk. You are drinking milk. Okay? I was wrong. I said eating milk. No, I was wrong. Now I'm saying milk is drinking, not eating. In this way, you can wash out his mistakes and he will not catch a complex, that is the inferiority complex. Then he will not hesitate in further. Even if he's doing wrong, he will not hesitate that mother or the attendants will comment on me. They will not comment on you. He knows that. And then, whatever he said, you should be vigilant all the times that whatever he does, mostly he copying you, he copying the others. They may be right, they may be wrong, but he is trying to do copy. Therefore, when he do that copy and is not able to do in the right directions, do not say that you are wrong. Then do the same thing and do the wrong things. Then then say, oh, I'm wrong. Simple trick, simple trick, and your child will not hesitate, your child will not stammer in life. And child, even that autism and the ADHD will not develop this kind of conditions. And if the mother is irritated all the time, and whatever he is doing, and she's not accepting that one, under those conditions, most of those genes coating, most of the coating of those genes will activated, that will be activated because having suitable environment. Irritation is the suitable environment. Mistakes and irritations are the suitable soil. Then that child will grow autism, though it was there. It was there in the genes, but it was not growing. It is not growing in all the children because their parents are well aware and they are not creating any environment, any atmosphere that may create irritation in the mind of the children. And ultimately, they will not stammer. Tathalona, hakalona, they will not. Because their parents had maintained that education which is required, and under that environment this is not the suitable time, suitable soil, so that this autism and ADHD can develop. So I think you pick up the points. It was in genes. Again, I'm repeating to going to the other points. It was in genes. You do not know. In your parents' first, second, third generations, they were having, but they were not developing in your father. They were not developing in his father. But sometimes the children are having this kind of behavior, and he's not only responsible. He's not the genetic character is only responsible. You are also responsible to provide a suitable soil and suitable environment. So therefore, it may or may not be. This condition may or may not be in your generations. But even then, you can start newly. You can grow the seeds newly. You you will start, you can do the beginning of this autism and ADHD in your children's, if your behavior is not according to the directions which we are telling you, which the children's philosophy is telling you, that when your child is growing up at the toddler's age, do not comment him. Do not comment him in the initial stages. Comment himself. In other words, you can say comment himself, not to your children. And then, after you have done wrong, then try to correct himself in front of him. So this is simple trick. And then even the new seed of ADHD or autism will not grow. Even the old seed which was already in the soil will not grow. So this is what there are, you can say, the limits of all these things. Limits, that especially because before 3 years if he do not understand, he do not have any hesitation or anything else, any egoistic attitudes. But at this age, he is having attitude, egotism, complex type of things, inferiority complex, or sometimes communications. He will hesitate to communicate with you because every time when he speaks, you say, no, 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 you're wrong. He will hesitate, and ultimately this hesitation will become his habit. And when he goes to school, or even when he plays with this with the other kids, he will continue hesitating. And if he's continuing hesitating, ultimately for the normal development of your child, it's not good. He remain behind from the society. And if you wish that your child should not remain behind the society, then you have to follow all these directions. Emotional regulations. Emotional regulations. Sometimes you are irritated, sometimes you are having some other concerns, and you do not want to listen the children's. Here, this is the priority. This is the priority, that your next generation deserves, that we are the priority, not your own other concerns for which you are fighting, for which you are thinking, for which you are not listening me. It creates a different kind of character in the mind of the children. They become emotional, very crying sometimes, sad, all these things. And ultimately, if it happens each and every time, some parents are very quarreling. They quarrel, especially when the grandparents are not there, especially when the couples, first of all, they get married, and after that, they start quarreling. They start quarreling, they start fighting even. And the child listens to those things. At that time, you will not listen to the children even. And when you do not, the question is of the toddlers. And at that time, toddler, it is nothing for him. He do not care about that. What were your concerns? Why you are fighting? It's not his concern. His concern is that whenever he wants to talk to you, you should listen him. Emotional disability develops from this type of conditions, when, because of your own concern, because of your family concerns, you do not listen him. You do not listen him, though later on you love him. Later on, you carry him and in your laps and love. No, that does not matter. Ultimately, when first time that emotional thing has been sown in his soil, and then it will grow ultimately, though later on you love him, whatever. No, that will not matter. Ultimately, the seed has gone to the soil. Therefore, special instruction is that, in because all the couples are fighting, Different opinions is everywhere, but that should be kept away from the children, especially the toddlers, especially the toddlers. As far as you can, your fighting, your quarreling, your behavior attitudes towards each other should remain away from the children, because they will copy this thing, they will preserve these things, and when they will preserve these things in their mind, ultimately they will make them emotional. And if you want to make your child should not be emotional, excess emotional is wrong, and it will maintain the excess emotional situations in his mind, and ultimately that will not develop in a normal pattern to your children. Concerning the communication skills, develop now, I have seen in your in the American schools, even from the you can say the kindergartens, they ask the children come to the stage, speak something about your mom, about your father, about your this and that, all that. Means they want to develop a character in the children's, that they can command the things. But in our countries, it's not possible. It's not possible. And that is why there are big books of the psychology, philosophy, how to do it with the children. And it is mentioned there in those books that communication skill is a must for each developing kids, especially the toddlers from 3 to 5 years of age. This is the foundation. Basically, this is the foundation. But if this age they are hesitating, they are not taking care of the what the commands they are being given by the teacher or by the parents, ultimately in the society he will remain behind. He will not be at the level of the society, whatever the society is doing. Therefore, be careful that let him say what he want to say. Listen him patiently, though he is saying the wrong words, though he is explaining the things in a wrong way. Listen him, then patiently do the same thing. Not the elder children, only children at the age of 3 to 5. Listen him patiently, do the things in a wrong way, and then again say himself sorry. Oh, I'm wrong. It should be this way. Then that his mistake will be washed out from his brain, and mistake of yours will be so over there, and he will say, oh, mom was wrong. Then after that the mom has corrected, then he will catch up those things, that this is the correct way, and ultimately he will listen to this. So pattern, there are a question of pattern. Sometimes you establish a pattern and you stick to that, that's okay. You have set up a pattern. At this time you have to go to bed, at this time you have to eat food, at this time. But when children stick to that pattern, is wrong. Because when they set up a pattern in their mind, because you are setting the pattern according to your facility, according to your choices, or as the time allows, and as your work allows, you set the patterns. But this is okay. Ultimately you can change it easily because it is your settings. But if the child is setting a pattern, and when you want to change this pattern, it will be very difficult, and your child will start crying, will become irritated. Therefore, there should not be a set pattern for the kids. Everything changeable. Even simple food. They have given the example over there that first of all, he takes milk from mother or from nipple. Ultimately, we give him smashed potatoes. Ultimately, you give smashed carrots and all those. Ultimately, you give him food. He changed. But sometime, if you set up the pattern, no, 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 he do not want milk, but you give him milk. Set pattern. No, you have to take this milk. Ultimately, this pattern will irritate him, and then he will become irritated. Means you are not supposed to set pattern. Always try to change things time to time so that child can accept the changes in his life. Otherwise, when when there will be any change comes in his life, he will be irritated, he will be disheartened, and he will not be competent to do the things because, oh, how I can do that, I have not done this thing. But you see, in the words from day one onward up to the end of our life, we try many new things, and we do that. Most of things we do competently, but most of the things we fails. But if you want that your child should have courage to do the things, even if he fails, even if he is not competent for something, make him do the things. Even if he fails one time, let him do. Even in the school classes, if sometimes he is feeling that, do not discourage him. Make his moral up that you have to learn more things. There is a big life in front of you. It's not the end of the life, it's a simple thing. And now you have to learn things. There are competitors, and you have to compete the words. And if you have to compete the words, definitely you have to repeat the things which you are not competent to do things. Now you are competent to do things. You should become competent to do the things. And ultimately, he will have a courage. Even after failing the things, he can do the same thing again, and he will succeed in that one. So means this is disheartening. After pattern, this is disheartening. Not to disheart your child. Even if he fails to do the things one or two times, give him a time, give him a courage, morally built up so that he can try it again. And never set the pattern. No, this is what you know that you can do that. No. Let him try the new things so that in the world you do not know what type of things he will face. Then he will not be disheartened when you will not be there. When you will not be there to take care of this and to advise to him, then at that time he will not be disheartened to face the new things. Therefore, it is instructed for the toddlers that mothers and parents who are taking care of the children should be more attentive of their own behavior so that they cannot grow the seeds type of ADHD and autisms which were hidden deep inside the soil, or even if they were not at that time, you should not grow the new seeds at that time. And this is all your behavior is responsible. This is all your attentiveness towards the children's at this age is responsible. So first duty of the parents is to develop their kids free from any inferiority complex, free from any complex or pattern type of things, free from all these things which are later on diagnosed as autism and ADHD. Or so that even if the pre-parents, the previous parents were having this type of conditions, you can subside that. There are sprays for the weeds. You can spoil the weeds with the sprays. And this is a spray that you can avoid, you can spoil the ADHD and autism in your children's if you follow these instructions. Understanding, patience when talking to him, not to saying him that he is wrong, egoistic attitude, communication skill, emotional skill, all these things you have to take care of. And under all conditions, he should not be pointed out that you are wrong. Always. He is not pointed out that you are wrong. No, you are wrong. Then correct your mistakes. Show him that I have corrected the mistakes. I was wrong. So today's lecture is over. Tomorrow I will explain you some symptoms of the autism. What is autism? What is ADHD? How you can differentiate? Though there are minor differences. There are minor differences in between the autism and in the ADHD. But even then, I will explain these things in the next lectures so that everybody can understand. And as you know that I'm explaining this life study systematically, just like you listen the Ramayana, you listen to Mahabharata in a serials. The same way I have started this serial in Punjabi, in Hindi, and English. One day it is in Punjabi and English, the other day it's in Hindi, or someday it is in Punjabi and in English, the other day is in Hindi. Same way, changing pattern so that everybody who understand Hindi, who understand Punjabi, who understand English can understand what I want to convey you, what has been till now medical science recovered by his philosophy. That is known as the philosophy of development of the children. So you can learn that one. And diseases already I have discussed with you, but time to time I will discuss the diseases of this age. And this autism and the ADHD is the disease of the mainly the toddler when we recognize it, though it is coming from back or may erupt now. But this is the disease we recognize or we diagnosed at this age, toddler age. So next lecture will be about the autism and the ADHD. I hope you will like these lectures. And my request to you is that if you like these lectures and you can learn something, convey this to the other, your nearest and dearest, so that they can listen, they can join with Sabrang radio station, YouTube and Facebook media, Radio Parvaz, Radio Punjab. I think you know all of them. That Radio Punjab is running from Bay Area since many years. They are also delivering my lectures on Monday, and Radio Parvaz on alternate day for Punjabi media, and Sabrang radio station, YouTube and Facebook media every day. Every day I'm delivering my lecture in different language. So I think the next lecture will be in Punjabi and Hindi. So you can listen that one. That will be first of all in autism and ADHD. Then next day it will be in English, autism and ADHD. Rab Rakha, God bless you all. I am your host Gurdeep Singh Sandhu, and my phone number is 408-687-1899. Anytime when you are suffering from any disease at any age, call me for the second opinion of your disease. And also, if you want to be treated with the scientific approach of the homeopathic medicines, call 408-687-1899. Wherever you are being treated, it's okay. But if you discuss with me, there is no consultation fee. If you discuss with me, I can tell you what are the natural principles of cure. Because when there was no medical science, at that time people were suffering from the diseases. And how the nature was curing them. How we were getting healthy after suffering from the diseases. There is a set pattern of the natures. And the same I can guide you about. If anybody is suffering from any disease and tired of any disease, I can guide you what's the right way of the nature for your disease. And even if you want to be treated with the scientific homeopathic approach, yes, you can call me 408-687-1899. Rabrakha, God bless you all. We'll see you in the next lectures.